Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Panel of inquiry on fumigation incident in Ekiti State, which sent over 100 students to hospital to make its findings public. After an almost 3-week delay owing to security concerns, Imo State flags off administration of second dose of Oxford AstraZeneca COVID-19 vaccines. And COVID-19 related deaths in the United States to surpass 600,000 amid fears of Delta variant. The World Health Organization, WHO, has welcomed the Group of Seven's pledge of 870 million COVID-19 vaccine doses, but says that many more is needed and quickly. Director General Tedros Ghebreyesus says some 10,000 people are still dying each day from the disease, and critically ill patients in Africa had a higher mortality rate. This is as a senior World Health Organization advisor says Africa will get priority treatment for the G7's pledge of 870 million doses of COVID-19 vaccines. But let's take a look at the COVID-19 situation update in Nigeria.
The number of COVID-19 cases have declined. However, Africa accounts for the highest mortality rate among people with several illnesses. This is according to the Director General of the World Health Organization at a recent media briefing on the global pandemic.
The number of deaths reported last week was similar to the previous week, and the global decline masks a worrying increase in cases and deaths in many countries. The steep increase in Africa is especially concerning because it's the region with the least access to vaccines, diagnostics, and oxygen.
The latest figures coming from the Nigeria Center for Disease Control, NCDC, shows that Nigeria continues to witness a significant decline in the number of COVID-19 daily infections. 12 confirmed cases have been reported from 2 states, including Lagos, which recorded 9 cases, while 3 cases were reported in Kwara. The agency also reported 0 cases from the FCT, Plateau, Nasarawa, Rivers, Kano, Imo, Sokoto, Taraba and Kaduna states. The latest tally has increased the number of confirmed cases in Nigeria to 167,078. 6 people have also been discharged after testing negative, raising the number of recoveries to 163,469. The latest update by the National Primary Healthcare Development Agency shows that almost 2 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while more than 600,000 of those vaccinated with the first dose have now received their second dose. While the pandemic is not over yet, the NCDC is advising Nigerians to take responsibility in protecting themselves, including the proper cleaning of surfaces in various spaces.
Let's now join our correspondent in Ekiti State, Babajide Agbeyo, who says sensitization is in progress to address COVID-19 vaccination apathy. He also reports that the panel of inquiry on the harmful fumigation at the State College of Health Sciences and Technology will make its findings public soon. If you recall, over 100 students of the school were hospitalized sometime last month following fumigation of the school.
Despite the apathy currently being experienced in the administration of the second jabs of the Oxford AstraZeneca vaccines in Ekiti State, the state government says force will not be an option, but it will continue to prompt and persuade those slated for it. There have been reports that many people have not shown up for the exercise, largely due to social media scares and other reasons. On the controversial COVID-19 fumigation at an Ekiti Health institution, which landed over 100 students in the hospital recently, the panel of inquiry set up to unravel the matter says it will soon make its findings and recommendations public.
There will be always some people who are concerned. There are people who got some uncomfortableness when they got the first dose. And they too will want to see what happens to those who went ahead to get the second dose. There were people who were apathetic before they got their first dose because they wanted to see the reaction of those who get the first dose. The same thing will happen in the second dose. There will be some apathetic people in the second dose listening out to what happened to those who got the second dose. But I am confident that in Ekiti State, everybody who got the first dose will eventually get the second dose. The concern now is that they should do it quickly so that the dose that we have does not expire.
The results of the panel's findings, it's been awaited. It is also hoped that ongoing vaccination enlightenment efforts by the state government will yield positive results. Babajide Agbeyo for COVID-19 update.
We also understand that all the students have since recovered. Well, let's move on to other stories. The second phase of the COVID-19 vaccination, which was earlier delayed due to security reasons, have commenced in all parts of Imo State. A visit to some of the vaccination points in the state capital, Owerri, showed that there was low turnout. Some of the residents who were present to take their second shot attributed the cause to apprehension. They're urging the people to take advantage of the improved security situation and come out to receive their second jab because the reality of the pandemic.
The day we had the first jab, there were so many people here, but you can see there are fewer numbers here. So many people are so apprehensive as a result of the security situation in Owerri and even, say, in Imo State at large. So that's why we're having this low turnout. But we just want to urge people. Everyone should just try as much as possible to get this jab, to get it done with, regardless. I think once you conduct yourself in a proper manner and things like that, you wouldn't have anything to be scared of. COVID-19 is real. It has claimed lots of lives. It has claimed some of the lives of some people I know, some loved ones. So the best thing is to do the right thing. And that right thing is making sure that you take your jabs, the first dose, the second dose. And the earlier we do it, the safer we are and the faster we'll get rid of this particular pandemic.
Reverend Sister Maria Joanna Zuzoma is the Executive Secretary, Primary Healthcare Development Agency in Imo State, and she joins us now virtually. Welcome to the program.
Thank you very much.
So it seems Imo State is a little behind other states in terms of commencing the second phase of the vaccination. I also know you're not a security personnel, but why do you think that it's now safe to roll out the second dose in the state?
Thank you very much. Yes, Imo State, we started a little bit behind schedule, but we are catching up. As of yesterday, we have 21% coverage of those who have had their first doses. We've been doing a lot of social mobilization, advocacy visits to community leaders and influential persons, church leaders, encouraging all to come out and take their second jab. And gradually, people are turning out. In some areas, there are low turnout, but in other areas, there is a lot of improvement.
But largely, what's been the response of people coming out to receive the second dose?
Those that are coming up, yes, they are very happy and they know, they are convinced of the protection they get from the COVID vaccination. But others are weary because of the security challenges in the state. However, on the whole, I think that people are really turning out for the second
So before the security concerns, would you say that there was a higher, perhaps, range of vaccine apathy, and that with the security situation it's even higher? Or would you just say that people are open to the vaccines, you know, except for the recent situation?
Initially, there was a lot of hesitancy to take a vaccine, coupled with security challenges. However, with a lot of advocacy, a lot of work that we are doing on convincing them to come out for their vaccination, even after we have finished the first phase, a lot of people are coming up to take their first dose now, which we are not yielding to, because we need to have enough to give to those who have had their first doses. So I would say that the apathy has really gone down a little, very low among our people. So now they really want to come up for the vaccination, because we have done a lot of work convincing them.
All right, we'd like to thank you, Reverend Sister Maria Johannes Zoma, the Executive Secretary, Primary Healthcare Development Agency in Imo State. Thank you for joining us on the program.
Thank you very much.
And health experts are assessing the factors responsible for the low cases and the reduction of community transmission in Yobe State. According to them, population and the vast land mass might be responsible, but they also reveal that more awareness, creation and support by development partners also aided in easing the spread of the disease across communities.
Yobe is one of the states with the fewest cases of COVID-19 in Nigeria, having recorded only 478 confirmed cases and 9 deaths in the last 13 months. The state has an estimated population of 3.4 million across its 17 local government councils. Experts believe the sparse population has helped slow down community transmission.
Because of the sensitization of people and the level of awareness being put in place, and that is why you see less number of people being contacted with COVID-19.
According to them, sensitizing traditional rulers and risk communication drives one house after another, as well as distribution of educational materials by development partners also played a major role in reducing community transmission. The World Health Organization, while celebrating survivors of the disease in 2020, explains it will give more support to the state in the areas of prevention and control.
We recognize that we still have some way to do, and we are continuing in the COVID-19 control effort. We are not relenting in that aspect, but this is a moment where we need to reflect on our gains and milestones and celebrate the successes that have been achieved, and then re-energize for the task ahead.
Yobe State received 61,630 first-dose injections of Oxford AstraZeneca vaccine and had vaccinated frontline health workers, public office holders, and the general public, while the second doses are currently being administered in the state.
Still ahead on the program, we have more on the global update of the pandemic. Please stay with us. Welcome back to the program. Coronavirus symptoms for the feared Delta variant are more like a cold for the majority of sufferers, experts have revealed. A headache, sore throat and a runny nose are now the most reported symptoms for those with COVID-19 in the United Kingdom, overtaking a cough, fever and a loss of taste or smell. Dr. Moni Gasper is a general practitioner in the United Kingdom and she joins us now. Thank you for joining us on the program.
Thank you very much. Good evening.
Good evening. I know the last time we had you on the show, you said we are all looking forward to the ease of phase 3 of the lockdown. But what do you make of the extension yesterday, and will it be enough?
I think it's a very difficult situation for everyone. the Prime Minister really didn't have any choice but to look after the entire population. So far, we have 3.8 million deaths in 200 countries across the globe. That is not to be laughed at. It's a serious pandemic we're still in, and we need still to take all adequate measures. Right at the beginning, the Prime Minister did say that lockdown would be eased based on 4 main criteria, and he's reiterated this over and over again: the number of deaths, the speed of the rise of infections, and the hospitals being potentially overwhelmed. So we need to prevent that before it happens, and that's the reason for this. Will it be enough? We hope it will be, but the truth is we don't know. It all depends on our behavior, on surge testing, on vaccinations getting into people's arms, not just in the UK, but globally as well.
So it isn't lockdown that is the solution. The pandemic remains. But where is the UK in terms of vaccination? Do you see the government vaccinating everyone before the 4 weeks is over?
The government is actually ahead of the game in terms of the vaccination. They met their initial criteria for all the vulnerable people to be vaccinated by the 15th of April, and they're actually ahead for the second batch of ages to be vaccinated. Just today, they've announced that by the end of this week, measures will be put in place to invite everybody 23 and above, and by July, all 18-year-olds and above will also be offered a vaccination. So in terms of the vaccination, the government is well ahead. The problem is not just about who's vaccinated in this country. So far, over 50% have had both doses of their vaccine, and a little bit more have had at least 1 dose. But we know that with this variant, the Delta variant, a single dose is not sufficient. So we do need other visitors coming into the UK to also be vaccinated. It's a global problem. It's not just a UK problem.
So let's go on to the Delta variant you just mentioned. Scientists are worried. In fact, a member of the Scientific Advisory Group for Emergencies said that the number of people dying from coronavirus, that it would rise. Are you worried about the way COVID seems to present itself now, which appears to be quite similar to a common cold?
That's absolutely right. But if you remember, even with the first wave, the first set of lockdowns at the beginning of 2020, not everybody presented with the same symptoms. You know, the classic symptoms described were the cough, the fever, and then soon after, loss of taste and smell were added to it. Soon after that, several other symptoms, until it's got to a point that for my colleagues and I, it's a situation of think COVID, think whatever the presentation of anybody presenting unwell, think COVID until proven otherwise. COVID can present in all sorts of ways. In the first wave, children presented with tummy pain, and that was not amongst the classic symptoms of COVID. When I had COVID last November, I didn't have a fever, I didn't have a cough, I was just very tired, which I attributed to just being overworked and not resting enough, but it was COVID. So COVID affects every organ system and can present in any way at all.
Just before we ask about perhaps the non-pharmaceutical protocols that's happening in the UK, what's your take on what's happening with the rest of the world with regards to how they're handling COVID-19, seeing as, you know, vaccines are not getting to some regions of the world?
I think that generally the situation globally is more in terms of human behavior. Vaccines, yes, we don't have enough doses for everybody that needs, but there's still a lot of complacency in terms of our behavior, in terms of social distancing, wearing masks. Those go a long way to try to protect individuals. Certainly, vaccines are the way out of the pandemic, but we also need to take into account all the other measures that are available, the other public health measures that are available to us. We can't emphasize enough educating the public in terms of what we need to do. vaccines are helpful, but we do know everyone can't have the vaccine for one reason or the other. So for us to achieve some sort of herd immunity where we cover the general population, then we do need to take into account all the other measures possible. And personally, I think that we can do a bit more in terms of public health measures.
All right, I would say that you've answered the last question, and that is with regards to what would you say is how high is the level of the non-pharmaceutical adherence in the UK?
Unfortunately, it used to be better. And I think, again, down to human nature, everyone has slipped a bit. We're all suffering to one extent or the other with pandemic fatigue. So we don't really like to wear masks as much as we should, and social distancing has been difficult at the best of times. And now that there's hints of the lockdown easing, everyone seems to equate that with you can socialize a little bit closer proximity, but that is not the case. And we can see by what is happening, and this Delta variant in the UK has affected more of the people who haven't been vaccinated and people who've only had one vaccine. The people who have social distance continue to social distance, because I guess it's become a bit of a habit now. So that is important to maintain.
All right, I guess that's a message to the rest of the world, the importance of the MPIs at this time. We'd like to thank you, Dr. Moni Gasper, General Practitioner in the UK. Always a pleasure. Thanks for joining us on the program.
Thank you very much, Millicent. Thank you.
The United States has now lost over 600,000 people to COVID-19. This according to Johns Hopkins Coronavirus Resource Center. A painful reminder that death, sickness, grief continues even as the country begins to return to something resembling pre-pandemic normal. Let's take a look at the global update.
The United States Congress stand together on the steps of the Capitol building as they hold a moment of silence for the 600,000 lives that have been lost to coronavirus in the country.
Ladies and gentlemen, please join Speaker Nancy Pelosi.
Despite holding the #1 spot in total cases globally, states like California lead the country's plans to reopen. In Kabul, Afghanistan's main hospitals grapple with a surge of patients, while others gather outside of oxygen factories, hoping to get their empty cylinders refilled. On Monday, 2 hospitals closed their doors to new patients after running out of beds, and on Tuesday, the country reported 1,647 new cases and an additional 78 deaths. Israel has told its citizens they can stop wearing masks indoors, ending one of its last main restrictions as vaccinations taper off after a record rollout.
I think here it's super special and important to the Israeli people, because first of all, we want to feel that we beat the coronavirus, and second of all, it's super hot in here, and to walk with a mask in the summer, in the Israeli summer, is really, really like hell.
About 55% of Israel's 9.3 million population are fully vaccinated. And finally, over in Europe, where Italians are rejoicing as a curfew was ditched for the first time in more than 7 months. Italy has the 2nd highest death toll in Europe after Britain and the 8th highest in the world.
Continue to take responsibility to protect yourself and others. Indeed, you can take a look at our website for more updates, also a better understanding of the pandemic. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Mwaka. Stay healthy.